Chris, what was GE's motivation to go through the IHE conformity assessment?
Well, from this point in time, IHE has only done conformity testing for vendor-level conformity. With the new product conformity testing, we are now able to test products at the same rigor that you would be testing at the vendor level. In the past, you would not know whether or not that is actually the product that vendor is actually tested. With the new conformity testing process, you will now know that this is the product that's actually been tested. So you've improved the quality of the product, hence you've improved the quality of the patient care by ensuring that you have a product that actually does do as it is supposed to do.
So what can hospitals and maybe even patients expect to experience as benefits from all this?
Well, the first thing that a hospital would get as a benefit is improved integration with other products. And the thing that patients will get from this is that they will actually have better outcomes by better interoperability with their systems that are actually providing their care. If you have an EHR system that's communicating to a patient record, you'll have better interoperability between those systems. The information that's being provided for the physician is also being provided for the patient. Hence, that patient will know how to take personal responsibility for their own care. It's an enabler for not only patients, but it's also a facilitator for physicians to provide better care for better outcomes.
What is going to be the effect with regard to IT investments?
Well, with regard to IT investments, the first thing is that the systems are being tested against standards, and with the testing of the standards, the interoperability is somewhat put on a level playing field with other vendors, so that when you do invest into a product that does the standards that IHE has profiled, the replacement, the add-ons of other systems to that infrastructure, IT infrastructure, is much more easily maintained. You can now purchase systems that do conform to the same standards. You can add them on quite more rapidly, and you can extend your healthcare environment quite more simply than you would without the standards. And the conformity ensures that those products actually do meet those standards.
When do you expect to achieve results after going through the process?
Well, quite rapidly. This is currently a product, and what we expect that once we've got the conformity assessment statement out, it's released for healthcare providers to actually access this conformity statement. They'll understand what our product does, and very shortly we expect to see users of the healthcare providers and IT groups actually start to use our systems and start deploying it as per the conformity statements define.
Do you expect users, hospitals, to add this aspect in future tenders?
It would be very advantageous for users and hospitals to be using this conformity testing certificate as part of their tenders. This really gives them the guarantee that the product that they've asked for, that they're requesting, is the product that's actually been tested with multiple vendors at this type of event. You will know that that those interfaces will, in fact, comply to the standards. As we know, that the standards are the best form of interoperability for products.